much for staying with us. We really appreciate your company since we started the show at 6 till now. And thank you so much for choosing KBC Channel 1 to be the channel that is waking you up this morning. Good Morning Kenya is the name of the show. And what we are doing now is the health segment that we have every Tuesday, talking about issues, health, to make you, a better version of yourself, to help you understand the basic things that you ought to understand about being healthy. Because if you're not healthy, then it can cost you a lot of money just trying to go back to that healthy life that you were on before. So this morning, it's all about gum health. And we will be talking about everything from the basic to the complex, just to help us understand how we can better take care of our gum. What is the role of the gum in the body? Why do we need even to take care of it? And how do we do that? What are some of the things that we ought to understand? The gum diseases, all these issues I will be talking about with my guest this morning. And allow me to introduce Daktari, who has joined us just to help us understand and make us really ask all the questions that we want to ask. I will be doing that on the behalf of my viewer. Dr. Tonnie Muli is a periodontist, and he has done a lot in this particular line of work. And one would ask, let's begin there, Daktari. Talking about a periodontist, what exactly do they do and how different is it from, the dentist?
Well, as in most medical professions, there are always areas of specialization that one can pursue. And in dentistry, periodontology is one of those. Yeah, and basically a periodontist is somebody who specializes in the care of the tooth supporting structures.
Okay.
As you can imagine, the tooth is not floating in the mouth, it's being held by some specific structures.
Like the foundation of a house.
Exactly.
Yeah.
So in that way, we are specialists in that field. Yes.
So we are talking about the gum.
That's right.
This morning, gum health, just to understand, even the gum diseases. So let's talk about, first of all, the function that it has in our body. What do we need to understand about this particular part of the body? For people to take care of something, they have to really understand how important that thing is for them.
Absolutely.
So talk to us about the gum, being a specialist. What role does it play to our bodies?
Right. As I mentioned before, the thing is, we need the teeth to be able to chew our food.
Exactly.
We cannot swallow food before it is chewed. That is the first stage of digesting the food. Before then it goes down to the stomach and the rest of the system, and then it is absorbed in the body. So we need the teeth. Now the teeth, as I said, they then have to be held by something. And this something is usually the bone underneath. And definitely you don't want to see a skeleton in the mouth.
Yeah.
You then have to cover it to make it look a little bit more beautiful.
Yeah.
And that's where the gum comes in. It covers that bone, which is the primary structure that is holding the tooth in place. And so besides that, the gum has that aesthetic value, and at the same time it has a very good blood supply that helps the bone to remain alive and to do its function. Yes.
So that is the key mandate. That's the most important role that it does to our bodies. Let's talk about the care of this particular part of our bodies. What are some of the things that we need to understand that on a day-to-day basis we need to do? Because it's all about ourselves. These are things that you cannot go and pay for services to be. So what do we do when we clean up?
Absolutely. I usually make a joke to my patients. I say, you know what, Kenyans love plots,
Yeah.
They like buying plots all over the place, a piece of land here and there.
Exactly.
And I say, before you buy that other plot out there, you need to take care of this plot here first, because, this is your first place where you live.
Exactly.
And so the mouth is one of those very serious places that you need to take care of it for you to be able to do many functions. For instance, you cannot speak properly, you cannot articulate properly certain words without having your teeth. Or even if you have the teeth, they must be firm enough and in the right place.
Yeah.
If they are not there, then you find, for instance, if you miss the front teeth, you cannot say Mombasa, you will say Mombatha. you know, something
Yeah,
like that.
true.
And so those teeth must be there. Two, we said even for nutrition and keeping yourself alive, you need to chew your food first, and then you can be able to get your nutrition. Again, you need the teeth.
To smile, you
To smile,
need the
you need the teeth.
Yeah.
I've met people that have struggled to get jobs simply because of how their teeth look like.
Yeah.
They try to smile, and
Just
it's
changes
difficult.
everything.
Yeah,
And
even
the
their
self-esteem issues, that
absolutely.
come with it. Yeah.
And besides that, we now know, current research now tells us that gum health is associated with health in other parts of the body or even other organs. For instance, right now we know that with gum disease, especially amongst the pregnant women, sometimes it may lead to early birth, I mean the child being born before term. Sometimes the children are born underweight and such similar problems. Again, you will have noticed that amongst pregnant women, a lot of times they have bleeding gums, and the gums look red and swollen, soft and soggy like that. Yeah, again, it's because of the hormones and the presence of gum disease developing. So all these things, the mouth being part of the body, as it is said, that actually the mouth is the window to the body.
Allow me to take you back a bit on that note of, you know, pregnant women. Why are you so specific on them? Is there something about their hormones and their body structure at that particular time that triggers gum disease? Why are they so vulnerable at that time?
Okay, it's not the hormones triggering it, but it's because of what the hormones do to the body, then they become more susceptible to gum disease.
All right.
Again, you'll notice that during pregnancy, there's a lot of, the body is stimulated to make a lot of vessels and things like that. Again, the immunity slightly goes down. And with all these other things that the mother, you know, the body of the mother is pushed to do, then you find that the demand is so much that the immunity goes down a little bit. So they are prone to infections. They are prone to all sorts of inflammatory processes. And so including the gums, as soon as there's a slight layer of bacteria in the mouth, then the gums would easily get inflamed. Yes. So,
so you've talked about gum disease. And this is something that nobody wants to have. But then we have people who've even had to lose their teeth because of that. Talk to us more about it. What is gum disease for us to understand? How does it develop? What are some of the things that trigger it?
Okay, going back again to the structures that form the tooth supporting structure, we say there are the gums, which is the soft tissue that we see, pink. Sometimes it's pigmented, like in Africans. And then there's the bone. And there's some cement that holds the tooth to the bone. And some other fibers, they are a bit more complex fibers that act as shock absorbers. So that when you chew, you don't feel like you're chewing on a rock. So all that system, when the disease process starts, the first thing you'll notice is that you're going to have some reddening of the gums. And then they become a bit swollen, a little bit shiny. And as the inflammation goes on, then it starts to spread downwards towards the bone. Now at that stage, we call that gingivitis.
This is the early stage, the first
very
stage.
early stages. And all that somebody will see is, other than those signs of shyness, redness, a little bit swelling here and there, they will also notice that they bleed. The gums bleed when they brush, or if they ever use toothpicks, they notice every time they use toothpick, the gums bleed. Or even in the morning, they might just wake up and find there's blood on the pillow, or such instances.
So it's not advisable to just see yourself bleeding and just look at it as normal, because many people think it's just normal that your teeth can just bleed when you brush, and it's just okay. People don't take it to be a very serious issue.
Absolutely.
It shouldn't happen.
It should never happen.
When it happens, something is wrong.
Absolutely. In fact, healthy gums, even under examination, when we use our sharp probes to check the gums, it shouldn't bleed. So anytime you see blood in the mouth, just know there's gum disease going on. At the early stages, I've said it's called gingivitis. And then if it's not treated, and this starts quite early, especially children get a lot of gingivitis. They hardly get the more destructive form of gum disease. But as now somebody gets into their late 20s, early 30s, then the disease starts to progress in most cases, and it gets deeper. It's at this point where now you start getting bone destruction. So the very thing that is holding your tooth in place starts to wear off. Unfortunately, in most cases, there is no pain. The only thing you see maybe is a little bit of gum bleeding here and there. Today, tomorrow, it's not there, on and off like that.
And this can happen in years. Like it can start when you're a child, you have the first stage, but then you just move with it, this normal, you feel like it's normal bleeding.
Absolutely.
No
and because
pain.
there's no pain, because pain is the main cause, or is the main catalyst to cause people to go seek for medical health. Because there's no pain, then a lot of people don't bother to
Typical
seek
Africans, going to hospital
Actually,
when it's too bad.
It's a global problem. Because there's no pain, then why am I going to see the doctor? I'm okay. That's the statement people say. I'm very okay. And now as the disease progresses, then we start finding development of spaces between teeth. People start saying, hey, I used to use, it used to be hard to put my toothpick through, but now my toothpick is just going through.
See, mwanya, you know that mwanya?
Not at all.
It's an issue. If you didn't have it before.
If you didn't have it
it's
before,
a problem. You need
now
to check.
it's developing, it means there's a problem. Sometimes you start noticing that the teeth are becoming longer. The roots are getting exposed. They're a bit yellow. The teeth are spreading out or becoming quite long. You may start feeling like putting a toothpick in between the teeth because they are itchy. And every time you put the toothpick in between, the gum bleeds a little bit and you feel very nice.
You feel nice.
Very nice,
exactly.
So that's a typical test for knowing that you have gum disease.
So this is stage 2 or still stage 1?
Well, now at that point, it has gone now to the destructive form. The initial one was just inflammation, swelling, you know, bleeding, nothing destroyed yet. But at this stage now, we are having the bone, the structure that holds the tooth, we are having it now destroyed. And unfortunately, once it is destroyed, it never comes back. So even if you came...
Never, like there's nothing you can prescribe or anything. You've just lost it.
I think we'll come to that now. That's where now treatment comes in. And there are reconstructive procedures that we can do in some cases, not all cases. And so we are getting this bone destroyed, the teeth now the roots getting exposed, etc. And you can imagine, because of these spaces between the teeth, food is getting packed there. And things are getting, a lot of bacteria accumulating there. And then we are having a lot of decomposition of all that organic stuff. And then bad breath sets in. And so that has been a big problem for a lot of people, that they complain of bad breath. And they can't figure out what the problem is.
They brush like any other person and still they can't understand. Some people have said it's related to your body health generally, that it can cause bad breath.
There is an aspect to that, but most of the main cause of bad breath emanates from the mouth. It's either a lot of bacteria accumulating on the tongue or gum disease. That is the main source of bad breath.
So this, before you move on, these symptoms, bleeding, slight bleeding, you know, having spaces in between your teeth, you know, these inflammations, and you're saying about that bad breath, these are things that we need to take seriously when it's happening.
Absolutely. Absolutely. And of course, as it is, the body always gives signals when there's something wrong. Unfortunately, as we said, for gum disease, there's no pain, which is the best signal. So if you see blood is supposed to be hidden somewhere. It should never be visible. You're either injured or you have a very serious disease. And in this case, in the mouth, it is gum disease.
So at what point do you start feeling pain? Like at what stage do you start feeling pain?
Okay, without going to a lot of details about the different types of gum diseases, because there are so many, some of them...
You can just, don't mind touching on the most common, because we
Yeah.
really need people to understand these issues.
Okay, the most common is gingivitis, and unfortunately, as we say, no pain most times.
Yeah.
But there are forms of gingivitis that we call acute,
Acute.
gingival diseases.
Okay.
And because they are acute, they develop very fast, and in the process, they cause a lot of pain.
Okay.
Well, I don't want to scare anyone with all the terms of what we
The
call them.
the medical jargon.
But they are definitely those very quick developing. They tend to happen amongst the underprivileged kind of parts of our society.
Okay.
Like when you drive around the town, you see the chokoras, quite a number of those have that kind of severe form of disease.
Okay.
People that are malnourished, smokers, etc. So sometimes they get that kind of very severe, fast developing gum destruction. Yeah, and in such cases there is pain.
Okay.
But otherwise, under the normal, what we see frequently and has been seen throughout the human generations actually, is that gum disease develops without pain, the destruction continues, and people almost accept it as part of the aging process. And then they lose teeth as they get to their 60s, 70s, in fact, sometimes at their 40s. And people think it's normal. It's not.
That is why it's very common in adults, this pain that you feel and losing teeth.
Yeah.
Children rarely go through that. But then that does not mean that they don't have gum disease. You say that it has stages.
Yes, that's
It develops
right.
slowly.
Yeah.
So what are some of the causes, the main causes or triggers of gum disease?
Okay, the main cause of gum disease is actually, by definition, it's an infection. It's a bacterial infection, mainly. And so if bacteria accumulate around the tooth surfaces and then close to the gum structure, then the inflammation starts. And the process is you get these bacteria getting close to the gums, and then the body detects these bacteria and starts to release those fighting molecules.
Yeah.
And in the process, as they try to fight those molecules, I mean the bacteria, not to get deeper into the tissues, those molecules also destroy your own self.
Okay.
You get. So it's actually, in one way, it's the body trying to defend itself, but then
it's
overdoing
fighting
it.
itself.
Yes.
Okay.
It's overdoing and getting some of the structures also destroyed. Yes. So the more the attack, the more the destruction. And so basically, the very essence why we brush our teeth is to eliminate these bacteria that then cause the body to have the destruction. Yes. So if one would be able to brush properly.
I was getting there.
Yes.
Because you're saying, okay, we have bacteria,
Yeah.
but then the body tries to fight the bacteria.
Yeah.
But then in the process, it kind of overdoes it.
Yeah.
So the solution would be to prevent the bacteria from existing in the first place. So let's talk about oral health, like the basic habits, the normal everyday routines that we have.
Yes.
What are some of the things that probably enhance the existence of bacteria in our mouth, and what do we do?
Interestingly, bacteria in the mouth are very important.
They should be there.
They should be there, and these bugs, they're so useful. Now, unfortunately, some of them would trigger the body to react a little bit more aggressively. And for that reason, we then say we have to try and keep the amount of bacteria in the mouth to the minimum. Of course, it's not possible to eliminate bacteria in the mouth. As you've seen, sometimes people use antibiotics, and in the process, some of the bacteria in the mouth are destroyed. And because of that, other types of bacteria that were not targeted by that antibiotic, they overgrow and cause problems. And you've seen people with a black tongue after taking antibiotics for some time. Those are some of the challenges of trying to eliminate the bacteria in the mouth. So the main thing is just brush properly. I think everyone needs to visit a dentist, and if the dentist is not voluntarily giving you information about how to brush your teeth, you can ask, request to be taught how to brush. I think that is very important. Yes.
People think, so who's taught how to? Your mother should have done that before.
Unfortunately.
And many people don't know how to brush their teeth. Would you mind taking us through how many times a day And what's the best way to go about it?
Typically, you want to brush at least twice a day.
Twice a day.
That is after breakfast and before going to bed. Now, mark my words, they're very specific, before going to bed. Because people sometimes brush immediately after dinner, and then they sit down to watch a movie or whatever, and they're sipping a cup of tea with sugar, and they're taking a biscuit or something else, but they have brushed already. And so they feel, I'm okay, so they go to bed. But in the morning, the mouth will be full of bacteria. Why? Because they took something after they brushed.
And in
So
the morning, before
yes,
you continue, people
yes.
prefer before breakfast because of the bad breath and all. So somebody feels like, let me brush before breakfast and then that's it.
Well,
so it should be after meals, or what are you saying?
Absolutely. Now, the thing is, if you do a good job at night, which actually should be the best time to brush thoroughly, if you do a good job in the morning, you'll actually surprise yourself. Your mouth will be very fresh.
So you
that's
can
right.
just take breakfast
You can
even
take your
without,
breakfast,
without
yeah,
brushing.
absolutely. And it doesn't do any harm to brush before breakfast and do it after. But the key thing is you want to do it after the food so that you eliminate the things that the bacteria will feed on. Yes. And now, when it comes to brushing, you see, that's just a general term. But brushing is more than taking your normal brush and going around the mouth and just scrubbing. And a lot of people brush like they are brushing a shoe, you know, just a scrub back and forth, back and forth.
There's no method as long as you
And
touch every place.
Absolutely.
Yeah,
And
so
then
how
the other
should we do
thing
it?
is they feel like the more they press, the better.
The cleaner it
But
becomes.
it is not so. In fact, if you're so aggressive back and forth like that, you will end up wearing off your gums. So you start finding your gum is receding. You start finding your teeth are being dug, you know, like there's a trench next to the gum, and the teeth become sensitive because you're exposing the roots. So again, I think the best way would be maybe when you visit a dentist and they demonstrate to you using a model and all that. But in brief, we tend to recommend some short vibratory movements with the brush at about 45 degrees towards the teeth. If it's the upper teeth, you're going like that. If it's the lower teeth, you're going like this. And either that short vibratory movement or a circular movement. Yeah, and just be gentle, but spend your time. Minimum
Take time.
about 2 minutes, and make sure you're systematic. Otherwise, as you move your brush from one area to the other one, you will easily miss out on some gaps, you know. So it is good to be systematic. You can choose your own pattern. You can go like from up here, go around, and then you come down, and then go inside, up to the end, and up to the other side.
So clean the teeth, the tongue.
Absolutely.
Everything.
Absolutely. As it is, just a small statistic is that bad breath, 40% of the cases of bad breath are caused by bacteria accumulating on the tongue. If you look at the top of the tongue, it looks like a towel, okay, with all these little projections. And bacteria just accumulate there. So if you don't brush those, obviously.
People say brush your teeth, so it's the teeth, you know. But then you're saying brush even your tongue and every part of your mouth.
Yes.
There's a question on that note already from one of our viewers. I wouldn't say the name on the number on air, but it ends with the 233. This is on our SMS platform. They're saying, I do have bad breath in my mouth, even if I brush with toothpaste. What will the problem be, and what should I do? 233, that's the number ends with that. Thank you so much for that. So, Dr. you can respond to that. They brush, and many people do that, but still they have bad breath. So what's the problem?
My experience has shown that a lot of people that complain about bad breath, or those who are conscious about bad breath, they tend to clean their mouths very well. And there's a big proportion of those who in real sense do not have bad breath, okay? But then they perceive that they have a bad breath. Now the thing is, anyone, as the day progresses, depending on the circumstances, for instance, if they stay quiet for long, the bacteria have a chance to build up in the mouth without being disrupted by a moving tongue or something that you're eating. And so as they accumulate, obviously, if you have those specific types of bacteria that produce the sulfur compounds that tend to give bad breath, then obviously a bad breath will manifest. there are some foods, of course, which also will produce bad breath, you know, like garlic and other things
yeah,
like
the
that.
most common.
Yes, and things like that. Sometimes it could be that the bad breath is not coming from the mouth. It could be the tonsils,
Yeah.
tonsil stones. It could be the airway, something going on.
No wonder they say
You
it
know.
can also come from other parts of your body.
Absolutely.
Your general body health.
That's right.
Wow.
It can be what we call postnatal drip, maybe something going on in the nose or the sinuses, and that mucus is dripping back to the throat, and then you can sense that as bad breath, etc. I think the thing to do with bad breath is visit the dentist. The dentist will examine and rule out any problems in the mouth. One, remember they don't know you. They are very objective.
Okay.
So they will be able to smell. You know, they ask you to breathe out,
Yeah.
and they'll smell, and they'll tell you whether
So
it's
don't
there
be
or
shy.
not. Don't be shy. I mean, they don't know. They are just professional and very objective.
So there you have it.
Yeah.
The number ending with 233, that's the response Dr. has given us. The SMS platform is actually 22162 in case you have any questions you want to ask us this morning. There's another question, Dr. Somebody, the number is ending with 391, saying, Dr. Tonnie, since last week I have experienced severe gum inflammation. The gum is so painful. I haven't eaten so far. I would like you to prescribe some drugs for me. Tony from Chuka, thanks. Yes, so your namesake, Tony from
That's
Chuka.
right. Okay, now,
Yeah.
Tony, pole sana, and I hope you'll be able to recover very quickly. Unfortunately, you know, like in medical practice, we do not usually just prescribe medication unless I'm very sure what I'm treating.
Yeah.
And again, there are many other things, like he might be allergic to some antibiotics and things like that. My advice would be maybe he dashes to the closest dentist and let them have a look, and I'm sure they will be able to get help. The other, maybe just to explain a little bit why somebody might get a lot of pain, apart from those acute gum, you know, conditions I was calling acute gingivitis. In advanced gum disease, when the bone has really been destroyed, pockets develop between the gum and the tooth, and stuff starts to go in there, and an abscess can easily form. Now, if an abscess forms, obviously it's going to be painful.
Okay.
So again, it is very hard to know, does Tony have the pain because there's an abscess? Is it simply because of a toothache? Is there a cavity?
So you have to visit
cracked,
a dentist to get all those answers, questions answered for them to know exactly what you require.
That's right.
We'll talk about treatment,
Yes.
because there has to be how you can treat.
Yes.
But then there's one last question. 707, that's the number, saying, what is the role of mouthwash? This is Joseph from Nairobi. Whichever brand, but what is the role? Why should the people, especially the rural areas?
Yes.
I don't know where you grew up, but then use a tree, you just take a stick, you make a brush and you use it.
Yes.
Some have toothbrush, but then they don't mind about toothpaste. It's not important. It's not a necessity.
Yes.
So what's the role of mouthwash?
Okay, mouthwashes are what we call adjuvant. You know, like it's something that can help you even get better results. But the key thing is the brushing, the mechanical rubbing away of bacteria from the tooth surface. That is the key. And maybe I just add a little bit. When we brush normally, we are brushing the surfaces that are visible in the mouth, like the outside and the inside. But we easily forget there's the in-between.
Okay.
So that in-between needs to be cleaned as well. And
In
that's
between
why
the teeth?
In between the teeth.
Okay.
And you can't do that with a normal brush. You have to use floss.
Okay.
Okay. And for floss use, I think you need to be taught
Okay, how to use
how
them.
to use it.
Okay.
Otherwise, if you use floss badly, like in a sewing movement like this, then you cut your gums and you will never want to use floss again.
Okay.
So once you're taught, you know you'll need to go up and down,
Okay.
you know, against the tooth surface. So there's that bit of cleaning. That should normally be sufficient.
Can you
But
do without mouthwash? Can you do all that
Absolutely.
without? So it's
Absolutely.
there's nothing
You
it
just
does in
need your
fighting the
toothpaste,
bacteria.
because the toothpaste gives you the feel-good factor.
Okay.
It also has small grits, you know, like material that helps with abrasion, at least to help you to rub out the stuff from the tooth surface. More like you're doing sandpaper, you know, on a piece of wood or something.
Okay.
So it does that, but it's safe enough not to wear off your tooth.
Okay.
Of course, it also has fluoride, which is very useful in defending your tooth against tooth
I think that is
cavity.
what the viewer meant by
Yeah.
mouthwash. I don't know exactly, but probably they're putting all that under the umbrella of mouthwash. Probably if you need a paste or something.
Yeah, there are times when we recommend mouthwashes because they are of different efficacies in
Okay.
terms of they are effective for different, you know, at different degrees. Now, some of those mouthwashes will only be prescribed by your dentist because they have the impact of reducing the amount of bacteria in the mouth. And most times, those will be given to people who cannot brush properly or after gum surgery or some other procedures done in the mouth.
Okay.
yeah.
I'm sorry I'm taking you too fast. There's
Yeah.
just so many questions coming in. A number ending with 225. Thank you for your question. They're saying, I lost the left and right premolar on my upper jaw. Now there is some swelling on the gum next to the left premolar, which always accumulates pus and burst out. What could be happening? There's pus in their mouth and they're not understanding.
Well, anytime you see pus, it means there's an abscess and an infective process going
Okay.
on. It could be that maybe the tooth, a piece of the tooth was left in there. It could be that probably a piece of bone was broken during the extraction or when the tooth was breaking down.
Okay.
And it's in there and it's infected. So my advice would be, again, please visit a dentist and let them examine. They'll take x-rays and be able to confirm what is happening and, of course, institute treatment.
Okay.
It is very
As we are just about to bring this to a close, very quickly now, you've really advised people to visit the dentist.
Yeah.
People are asking, after going through all that, there's a lot of pain they're going through and all that. Are there ways of treating gum disease? Something you can share with us this morning, or all hope is lost?
Going back again to the cause, eliminate the cause, you're on your way to recovery. So if we can get rid of the bacteria and the reasons why it accumulates in the mouth, then your body will always come back to as normal as possible. So the first thing that we usually do is examine the mouth and see where the bacteria, when the bacteria stay in the mouth for long, then the minerals in the saliva and in the blood, in the gums and all that, it gets deposited into that bacteria sticky stuff on the teeth. And that stuff becomes almost like concrete. That's what we call carb killers. In the common term, we call it tartar.
Okay.
So it gets stuck, and now you cannot brush it out, no matter how much you try. So it stays there, and then it's porous, and bacteria just keep accumulating there. And no matter how much you brush, your teeth will never again be clean until we remove that tartar.
Okay.
It's like trying to clean a very rough surface compared to cleaning a tile. You know, so the first thing the dentist will do is try to remove all that tartar. Sometimes the tartar has gone so deep inside below the gum line, you may not even see it yourself. And so the dentist will have,
removed.
Yes, will have to go in there. And sometimes it's so deep that you have to be anesthetized for them to go there.
Because of the pain.
Yeah, exactly.
Okay.
So sometimes it has to, the dentist has to do that. And that is where now a periodontist comes in. When it gets deep to a certain level, then now the patient needs to be seen by a periodontist who may even then recommend gum surgery, where we have to lift the gums out and be able to visualize even up to the bone. And sometimes we even have to do something to grow the bone. We can actually graft bone and build it up again. And so those are some of the things that we can do. Again, gum disease will cause the gums to be stripped out. You'll see the gums are receding, and the teeth becoming quite long. And so, again, that's something that a periodontist can come in and try and graft some soft tissue and cover the roots again. So at least you can have a better smile.
All right.
Yes.
Everybody loves a good smile. I hope my
Absolutely.
smile is good. But I've
That's
really
great.
learned a lot, Dr. this morning. I know this conversation, we can always, talk about it because there's just a lot we need to understand with something as basic as just cleaning up our mouth. But then we've run out of time, unfortunately, for today, but we can always invite you again to continue. But what's your final word? The take home for the viewer this morning, what would you like them to remember?
I mean, there's quite a lot of information about gum diseases and generally dental diseases and things like that. More clinicians are coming up and giving information and free talks and things like this, which I think is very important. Information is power. For those who would like, in our website, we've put a lot of information there and blogs, to try and teach people how to take care of their teeth and specifically the gums. And even issues like implants where you're missing a tooth, we can plant teeth, almost like natural. And so all that is available in our website. And if you go to the Facebook, you'll find the periodontist. You can look for that. You'll find a lot of information there.
Thank you.
In our website, theperiodontist.co.ke. You can find more information there.
Thank you so much. We've run out of time, and we really appreciate you coming to share with us this. And thank you for
very
watching KBC Channel 1. Since we started the show at 6 till 9, we are so happy that you could create time to be with us. Why don't you do that tomorrow again on Wednesday? Because we have a lot that we have lined up for you on this particular episode of Good Morning Kenya and the others to come. Keep watching KBC Channel 1 because we have so much again that we have for you. My name is Serfin Achieng, and I was doing this together with Martin Mwanje. On behalf of the entire production crew, enjoy the rest of your viewing and keep watching KBC Channel 1. Stay warm to avoid the cold.